next, we will learn about careers in the laboratory. Hospital laboratory staff are the medical mystery solvers who turn test samples into life-saving answers. Working behind the scenes with precision and care, they play a critical role in diagnosing illness and guiding treatment decisions every day. The team from Meade District Hospital, Artesian Valley Health System in Meade, shares the care options available in a hospital laboratory.
Welcome to Meade District Hospital, located in Meade, in the heart of rural Kansas. Today, we're taking you behind the scenes of our laboratory department. A place where science, teamwork, and patient care come together every single day. In this video, you'll see what a day in the life looks like for laboratory professionals and how their work supports nearly every patient who comes through our hospital. We'll show you the hands-on skills used during a typical shift, from collecting samples to running tests and reporting results. The laboratory is staffed by several professionals who work together to provide accurate, timely test results for patients of all ages, from the emergency room to routine clinic visits. Let's meet some members of our team.
I am Tammy Bird. I am the lab manager here at Meade District Hospital, and my role here is to manage the lab, maintain regulatory compliance, and aid and assist my techs in the day-to-day testing to help provide diagnoses for each of our patients.
I'm Jamie Post. I'm a medical laboratory technician here in the lab, and we analyze bodily fluids, urine, blood, stool, spinal fluid. We run COVID specimens, and to help our doctors diagnose.
Now we step inside the laboratory, where science meets patient care. This is where samples are received, analyzed, and transformed into results doctors rely on. Phlebotomy is the first step in the testing process. Patient identification, safety, and proper technique are essential. Once collected, specimens are labeled immediately to maintain accuracy and traceability. In hematology, we focus on the study of blood and its components. Automated analyzers are used to count and measure red blood cells, white blood cells, and platelets, providing critical information about oxygen transport, immune function, and clotting ability. These results help doctors identify conditions such as anemia, infections, blood cancers, and clotting disorders. In addition to automated testing, technologists examine blood smears under the microscope, where subtle changes in cell size, shape, or number can reveal important clues. These tiny details often tell a much bigger story about a patient's overall health. Next, we move to clinical chemistry. In this department, blood and other body fluids are analyzed to measure hundreds of chemical substances, including glucose, cholesterol, electrolytes, and enzymes. These tests provide important information about how major organs such as the liver, kidneys, heart, and pancreas are functioning. Abnormal results can indicate disease, organ damage, or metabolic imbalances. Clinical chemistry testing is essential for diagnosing conditions like diabetes, kidney disease, and heart disorders, as well as monitoring patient progress and the effectiveness of treatment over time. In microbiology, we study microorganisms that can cause disease, including bacteria, fungi, and sometimes viruses, using patient samples such as blood, urine, or swabs. These organisms are grown in the laboratory and carefully identified using specialized tests. Once the organism is identified, technologists perform antibiotic susceptibility testing to determine which medications will be most effective at stopping the infection. This information helps doctors choose the right treatment, reduce the spread of infection, and prevent antibiotic resistance, ensuring patients receive safe and timely care. And here is the blood bank, one of the most critical areas of the laboratory. In this department, donated blood is carefully tested to determine blood type and screened for infectious diseases to ensure it is safe for transfusion. Technologists then perform compatibility testing to match donor blood with the correct patient, reducing the risk of transfusion reactions. Every step must be performed with precision, because even a small error can have serious consequences. In the blood bank, every drop truly matters, and accuracy can be life-saving. After exploring the different departments of the medical laboratory, it's clear how each plays a vital role in patient care. Behind all of this testing are highly trained professionals whose education and skills make these results possible. If you love science, technology, and problem-solving, a career in the laboratory might be the perfect fit. Medical laboratory professionals study subjects such as biology, chemistry, hematology, and microbiology, while learning to operate the advanced instruments used in today's labs. This career blends scientific curiosity with patient care, and no 2 days are ever the same. Every test performed helps answer important medical questions and contributes to better health outcomes. The journey to becoming a medical laboratory technician begins now. After graduating from high school, you'll enroll in an MLT program, offered at a community college or technical school. The program takes about 2 years to complete and leads to an associate degree. After finishing the program, most students pursue professional certification. Once certified, you will be ready to work as an MLT. MLTs can find employment in hospitals, clinics, medical laboratories, and research centers. Many MLTs further their education to become medical laboratory scientists, lab supervisors, or educators. Thank you for joining us for a day in the Meade District Hospital Laboratory. We hope this video has shown you how important laboratory science is to patient care and maybe even inspired you to join the next generation of lab professionals.
I want to welcome our panel. Joining us this morning to answer questions about career opportunities in the laboratory is Tammy Bird, Laboratory Manager, and Jamie Post, Laboratory Technician, both working at Meade District Hospital, Artesian Valley Health Systems. Good morning.
Good morning.
Good morning.
So good to see you both. So I wanted to start with a question for you, Tammy. Could you share where you went to school and what drew you to a career in the laboratory in the first place?
Okay, I went to school in Oklahoma at Southwestern OSU, and it was a junior college at that time in Sayre, Oklahoma, and then they affiliated with Southwestern OSU. What drew me to the career I chose was a personal reason. In high school, excuse me, my mother had suffered from a stroke when I was a senior in high school. And so I was in her waiting room several days, and I would watch professionals come and go out of her room. And I got opportunity to see many different roles in taking care of people. And I always knew that I wanted to take care of people, but that kind of gave me the opportunity to see what different roles are in the healthcare setting. Radiology came in, physical therapy came in, lab came in, providers, nurses came in. And so I had opportunities to watch and observe and ask them some questions. And at the end of the day, I think the lab appealed to me. Probably a lot of it is, I do like science, but then it was just each day whenever the doctor would come in and say, well, her numbers are looking better. And I thought, well, how did the numbers look better? And how does that play the role in my mom's outcome and treatment? And it just really inspired me. And I thought, well, I want to go into that and be part of diagnostics and part of treatment and outcome.
Thank you. That's really a great story, Tammy, and hopefully inspires other folks listening today. Jamie, I think the video did a really great job explaining the requirements for an MLT position in the lab, but can you help us understand what the difference is between a medical lab technician and a phlebotomist?
The medical laboratory technician does, draw blood in the hospital, outpatients, inpatients, ERs, and runs the diagnostics test. And then the phlebotomy, they're the main person at the front that checks people's in, checks their IDs, draws the bloods, puts the blood in the specific departments to run, and goes out on the floor and will draw patients.
You guys actually in the video look like a really cohesive team, but do you feel like most of your days you work independently? Or are you really working in that team environment? How does your day look? Is it a lot of time one-on-one or just with the team?
I feel like it takes both. Individually, we oversee whatever department we're working in that day, but it takes a cohesive team to pull it all together and get the full picture. And if one person is busy, the other people jump in and help out because one department might not be as busy as the other department that day. So I feel like it is a team effort as well.
And you agree, Jamie?
Yes. Yes.
Yeah. Well, Jaren, I know we have a lot of folks on today and potentially a lot of questions in the chat, so I don't want to hog the microphone. Jaren, what kind of questions do we have in the chat for these guys?
Yeah, thanks, Cindy. There are quite a few questions coming in, so let's get to as many of those as we can. And so the first one comes from Jill. Can having too many electrolytes or much electrolytes in your body hurt you? And then also, how does someone find out their blood type?
Very good. So on the electrolyte balance, it is a balance. If you have too much potassium, it can cause cardiac arrest. If you have too low potassium, it can cause muscle cramps and pains. The same with sodium. Dehydration plays a key role when your electrolytes are out of balance as well. And then on the question of the blood type, did you want to answer?
You would come in and get your blood drawn, and we would spin down that, it's a purple top. We would spin it down. The top part of the tube will have the plasma and the bottom part will have the red cells. So then we pour off the plasma, and then we pour off some red cells and make a dilution. And then we have gel cards that have the anti-A, B, D, and you would incubate the blood, spin it, and then read it. How do I want to say it?
If it agglutinates, then you know, if in A, then you're at A. If it agglutinates in B, you're B. If it doesn't agglutinate in either one, you're O. So it's a process, but it's fairly simple and quick, and you just have to get your blood drawn to see.
Interesting. Okay. Well, there you go. Maybe some folks will want to have their blood drawn after this to figure out what their type is if they don't know. But all right. Well, thank you both. The next question we have comes from Emily. And she asked how many patients or people you might see in a day, but also maybe a way to spin it is how many maybe tests are you running on a day-to-day basis?
Good question. Good question. Here at the hospital, so we deal with inpatients, outpatients, ERs. So it's kind of a toss-up. We probably, on an average, I would say between the clinics and everything, I would say we do 50 patients at least a day. With the testing, like one patient might have 10 tests, one patient might have one test. So you kind of just use that as a guide and a factor of how many specimens that might come to you in one day.
Well, and then the next question, we have a couple of them that are touching along these lines. So how do you essentially guarantee accuracy with the tests? Do you ever need to rerun things, get blood more than once for a patient? What does that look like to try to really determine, if the test is giving the right results?
Very good question and very good concern. And that's what we want to have our patients all rest assured that we do put out quality results. And in doing that, every day before we even start to run anything, we have quality controls that we have to run. If any of those are out of range or out of specifics, we cannot accept any patient test. So we have to get those in control. And it could be, something might look funny at the middle of the day after we ran our QC. So if something like that was just spark an interest of this doesn't look quite right, we would rerun the patient. We would run the QC with it. And then if it had good QC, it's either the patient needs to be redrawn and just rechecked, or it truly is the patient is having some abnormal values and issues. If the QC is out of whack, it could be that it's an instrumentation issue. So.
And what is QC? Since I'm sure a lot of folks might not be as familiar with some of our terminology.
Good question. QC is quality control. So it's a procedural control to just assure that everything is working as it should.
Okay. Well, thank you. The next question maybe we'll field to you, Jamie. So Kristen is wanting to know, how long does it take for a standard lab test, or how might that vary depending on what test you're running?
Like a routine urine test would take like 7 minutes because you got to spin the urine down for 5 minutes. The dipstick takes, I think, 50 seconds to read. A CBC to run on automated machines may take 2 to 3 minutes. Your chemistries, they may take anywhere from 15 minutes to like an hour and a half, like your thyroid, your B12 folates, PSAs, they'll take a little longer than your like your liver enzymes or your sodium, potassium, glucose. In some specimens, we have to draw on the serum tube, so the blood has to clot. So, and then spin it for 10 minutes. So it's just varying. COVID specimens, about 47 minutes. So.
Yeah, it could vary a lot, it sounds like. Yeah, that is
Yes.
interesting. Well, the next question comes from, looks like somebody from Manhattan High School. Someone is wanting to know, how do you ensure you don't mix up the different patient tests?
That you don't mix up the patient's test?
Yeah.
Okay. Very good question and concern as well. From the very get-go, our key role is patient identification. And so from the very beginning, whenever you have the patient state their name and date of birth, and then you draw their blood, and there's some labels that go with that patient that has their name, their specimen number, their barcode on it. And so you attach that with that specimen at that patient's bedside, so you know that you've got that patient and that blood is theirs. So when you go results, and you can be assured that those are John Doe's test results.
And then maybe the last question here before we wrap it up, someone's wanting to know, and this is a great way to end things, what is the best part of each of your jobs? What do you enjoy most about working in the lab?
I personally, like, as the patients come to the front desk, I like greeting them with a smile, trying to make them feel comfortable, like we care, be an active listener of, what they're there for today, or try to ease their mind and letting them talk. But I like direct patient contact, drawing their blood. And I mean, I love all aspects of the lab, but patient care and getting to know the patient and to make sure that they feel secure and safe and they have a wonderful experience in the lab, getting their blood drawn or getting a throat swab.
As for me, I think the most rewarding part is, and what I enjoy, I do enjoy the patient interaction, as Jamie does as well. That's just part of healthcare. But I enjoy being part of that diagnostic piece of the puzzle, so that I can provide the doctor with answers on the patient's diagnosis and treatment and outcome.
Well, Cindy, we could again ask a lot more questions, but it's time to turn things back to you for the next segment.
Thank you so much. And thank you for joining us this morning, Tammy and Jamie. We really appreciate you sharing your insight on getting into a laboratory career.